No, yeah. At Guy's Hospital, then we'll take referrals from around the country. I hope you can take away some of these techniques to try yourself, and some, like I highlighted, should be available locally as well. If most areas now are beginning to develop CBT programs for insomnia, and a lot of this, particularly the earlier part about maintaining a sleep-wake cycle that's regular, would be contained within that program. So even if you couldn't come to see us, I'm trying to make it as accessible and open as possible, then trying that way might be helpful too, just to give more options. Yeah. Do you want me to do that first? Yeah. So for people who live in one room and you want to do stimulus control, you just want to make the bedroom look different in the daytime from the nighttime. So our brains are really look at cues all the time that we're not even aware of. So what I would recommend people to do is to have a different covering on the bed in the daytime, and maybe a poster or a potted plant that they just have in the daytime. And then at nighttime, put those away. And over many nights, the brain will quickly learn, this is the room in daytime mode, we're working in this room, or we're eating in this room, or we're living in this room, and this is the room in nighttime mode, we know what's coming next. And it will almost become a powerful, even further stimulus that your body will know what's coming, it will know sleep is coming, it'll become part of your sleep bed routine as you're taking away that cover, putting away the potted plant and the poster. So as many cues as you can put in to make your environment look different in the day and the night time, that will really help your brain know what mode the room is being used in. Does that make sense? I'm so sorry, I'm just trained and qualified to treat adults. Image rehearsal therapy to help with nightmares definitely works for children. And children can have absolutely great fun with this. I'm afraid the rest is outside of my remit, sorry. Yeah. I don't think that's compatible with life. So people may have very limited deep sleep and not get the deep sleep that one would sort of recognise to be within a usual range for their age. But a life without deep sleep is just detrimental to mental and physical well-being. So there's none, and we're going to steal from ADHD, which Guy spoke about earlier. So most of the evidence, for example, within stimulants in terms of safety comes from ADHD. And in my ADHD patients, I'll absolutely use nicotine in lozenges, in patches, in intranasal spray. It's another stimulant. But it needs to be used carefully, and it's good to have a chat with your doctor that you're using that as a stimulant, and they should help you with that. But yeah, it makes complete sense.